Today on Investigate TV Plus, she bravely told her story about fighting addiction.
And I couldn't really live a life.
But months later, police would find her body surrounded by canisters of nitrous oxide.
When it's so accessible, it's almost impossible to overcome. And I really firmly believe that if it wasn't so accessible, she'd still be here.
We'll explain the impact of this easily attainable drug and the solutions advocates say could save lives.
Then some patients are ditching insurance and paying out of pocket for medical procedures.
That was amazing because we had to talk to friends who've spent $2,000 after insurance.
Why doctors say the choice could save you money.
And everything changed for a nurse after a car crash left him paralyzed.
Laying in the hospital bed, a lot of long nights of just thinking. Didn't know what my career path was going to lead to because I invested so much into the program, becoming a nurse.
How he achieved his dream and now uses his story of perseverance to inspire his patients.
In-depth stories that inform and inspire. You're watching Investigate TV Plus. Whippets, Galaxy Gas, Super Whip, all nicknames for an easily available drug with potentially deadly consequences. I'm Lee Zurich.
And I'm Tisha Powell. Colorfully packaged canisters of a gas often used legally in kitchens and dental offices. You may also know it as laughing gas, but its recreational use for getting high is growing in popularity.
I was just looking to see if you sell Super Whip.
Super Whip,
Yeah, Super Whip you got?
We've gone undercover for our investigation to show just how easily accessible the drug is at vape shops, gas stations, even online. And because it's readily available with little oversight, some warn that can fuel an addiction.
Even after you had brain surgery, you went back to using again.
Yeah.
Do you remember thinking this is nuts?
I was aware it was crazy, but I mean, I didn't care. I was like still so addicted to it and I couldn't stop.
In Nashville, Tennessee, Kelly Rosenthal opened up about her addiction to nitrous oxide. But just months after her interview, she died, surrounded by canisters of the drug.
Investigative reporter Jeremy Finley spoke with her closest friend, who hopes to inspire change by sharing Rosenthal's story.
911.
My sister's in her apartment. I think something happened. She hasn't responded for 2 days, and her phone is off, and her work hasn't heard from her.
When Kelly Rosenthal's brother called 911 on June 23rd,
She's packages out front.
he feared the worst.
I don't think she's alive.
Katie, it looks like that you and Kelly go way, way back.
28 years, actually. She was just the funniest person anyone has ever met.
In New Jersey, Rosenthal's best friend since childhood got the call.
People will say, like, didn't you see it coming, right? And the thing with this is I never, ever saw this coming.
4 months after sitting down with me to tell her story of battling addiction to nitrous oxide,
And I couldn't really live a life.
Rosenthal would die alone in her East Nashville apartment. According to the police report summarized in this email, there was a large number of unused nitrous canisters lying around the victim and throughout the bedroom.
It's really like losing a part of me.
So did she tell you about doing the interview with us?
Yes, she was very, very excited. She was very proud of herself.
She was so brave with us to even share the photos of her in the throes of addiction and just how it just wrecked her physically.
There was a lot of light out of her, but she was still fighting.
Fighting and wanting to put a human face on how easily nitrous oxide can be purchased.
How easy is it to get it here in Nashville?
You just could walk into any smoke shop if you're, I guess, over 21 and ask for it.
So it's easy?
Yeah, it's pretty easy.
Her guidance allowed us to go undercover, instructing how you can walk right into vape shops and walk right out with colorful containers filled with nitrous, labeled to be used to make whipped cream. Rosenthal knew this because that's how she got the drug.
My whole apartment was just filled with trash of the little canister things.
Do you feel like it is dangerous that it's this easy to get?
Definitely.
I interviewed Rosenthal in this sober living house, and as she'd planned, she then moved out into this apartment.
The months leading up, we were making plans for her to move back to New Jersey.
When you found out that she had overdosed, if you're asking yourself what happened?
Absolutely. I immediately went to nitrous. That's the first thing that I thought of when I got the call.
Rosenthal's friends and family are now urging lawmakers to stop the sale of the drug in Tennessee.
When it's so accessible, it's almost impossible to overcome. And I really firmly believe that if it wasn't so accessible, she'd still be here.
As of October 2025, Kelly's family was waiting on her autopsy results and the official cause of death.
While the sale and purchase of the drug isn't against the law in Tennessee, other states have cracked down on where nitrous is sold and how it's marketed. New York State Senator Joe Adabo believes the packaging, often with bright colors and catchy names, is enticing to kids. He helped successfully ban the sale of nitrous oxide chargers to minors in New York.
I got to tell you, since we passed our legislation in New York here, I don't see those used canisters on the corner anymore. I don't, which means the retailers got wind of what we were doing legislatively.
On an even bigger scale, in 2024, Louisiana became the first state to ban the sale of nitrous oxide in stores and increase the penalties and fines for violators. A year later, the Bayou State banned online sales and flavored additives for the gas.
Several other states have considered taking similar action. You can learn more and watch our full series on InvestigateTV.com. Just search nitrous oxide.
Still to come, when insurance delays a medical test, one mother turns to a clinic where she doesn't need coverage.
We were just really thankful to be able to get that done quickly, affordable, have some information.
We examine a growing trend offering an alternative to where patients can get treatment and how they pay for it.
Then later, frustration finding the right property.
I think it feels a bit like a roller coaster because we get our hopes up and then we put our offer on something and it goes away and you gotta jump to the next thing already.
We explore why first-time home buyers could have a hard time breaking into the market.
Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms. Health insurance can cost hundreds of dollars every month, and even after your coverage kicks in, you could still be on the hook for a big bill.
However, some patients have found for certain medical procedures it's cheaper to pay out of pocket than filing an insurance claim.
Reporter Carrie Beal is at an MRI clinic in Greenville, South Carolina, with an in-depth look at how it works.
Greta Fuller is looking at photos of her 10-year-old son.
Swimming, football, soccer, basketball, all the things.
But in the fall of 2024, everything came to a stop. He was sidelined by severe abdominal pain. His doctor recommended he get an MRI.
The doctor was having a little bit of a hard time getting insurance to approve the MRI.
Not wanting to waste time, she decided to go somewhere else.
I was able to get Seth in that day.
Imago in Greenville doesn't take insurance. Instead, patients simply pay out of pocket. An MRI scan is about $500.
That was amazing because we had talked with friends who've spent $2,000 after insurance.
Feeling like it's getting a bit better?
She's not the only patient choosing to pay out of pocket. Palmetto Proactive Imaging Center in Spartanburg is another self-pay location that recently opened.
It's just me right after a play, getting the next play for the team.
DJ Horton took his son Gray to the clinic for an MRI.
The genesis of our need really came from some pain that he had consistently in one of his knees. He's very active.
They were given a discounted rate because they have a membership with Palmetto Proactive Primary Care.
So we had both knees, and out of pocket, I think it was about $350 to $400 per knee.
The cost for a non-member MRI at Palmetto Proactive is usually $500 to $600, which is a far cry from what hospitals charge.
There is so much red tape, and there are so many layers of complexity in the traditional insurance route it's a great option.
Hospitals are required to post their prices online. You can usually look this up with the price estimator tool. So I looked up the cost of an MRI on the leg because that is what this little boy had. The two big hospital systems would charge about $2,000 if I pay cash. They often offer a discount when you don't use insurance. But get this, if I use my insurance, it would actually be more, around $3,500 for an MRI because I've not met my deductible.
I'm just so happy to see him loving life, living life.
Both parents say their kids got the treatment they needed after the MRI and are healthy.
We thought this was a much better economical decision, but it's also been way more than that.
We were just really thankful to be able to get that done quickly, affordable, have some information, some thoughts on how to move forward.
It's important to note if you get an MRI at one of these clinics, it does not go towards your insurance deductible. It's simply an expense you pay out of pocket. Some urgent care clinics and doctors' offices take insurance while also offering self-pay pricing. But we talked to doctors who have ditched insurance completely, saying the middlemen in the system often contribute to higher costs. Instead, they offer what's known as direct primary care.
It's kind of like Netflix. We talk about that as another kind of subscription-based. You can watch as many shows as you want, or you can watch no shows.
For a monthly, quarterly, or annual fee, patients can get unlimited doctor visits, annual exams, flu shots, x-rays, and much more.
We'll put in stitches if somebody needs stitches, if they cut their finger, skin procedures, if we need to take care of skin cancer, if we can handle it here, we'll do it, and it's all for that one monthly fee.
He says patients are often able to schedule same-day appointments and get more time with their doctor. According to the American Academy of Family Physicians, monthly membership fees range from $50 to $100.
Still to come, a nurse proves healing happens when we refuse to let circumstances define our limits.
They tell me, man, I see you in this wheelchair, that makes me want to go harder and, do better for myself.
But first, being priced out of home ownership.
Growing up in a home with my parents, it's like I can't afford what they had at the age that I am today.
We follow first-time home buyers as they discover why starter homes are harder to find.
Buying a home for some is part of the American dream, but you might not be able to afford your forever home right away.
That's why first-time buyers often turn to what's known as starter homes, ones that are typically smaller and less expensive. But we've uncovered the concept is changing as experts say entry-level homes cost more and the buyers are older.
Reporter Susan Campbell shows us the challenges prospective homeowners face.
It's a lot of counter space.
It's a huge island.
It is huge, and it's out of the budget.
We're trying to stay under 6.
Adriana and Bradley Hill have been on the house hunt for months. They want to buy their first home.
We got married last year. We got a dog, and he wants space to run around. So we decided, hey, now or never.
They've toured at least 20 homes, put in offers on 3, and they've been outbid 3 times.
I think it feels a bit like a roller coaster because we get our hopes up and then we put our offer on something and it goes away and you got to jump to the next thing already. You got to move on and kind of disassociate from the last one before, put all your eggs in one basket.
If it wasn't for your calm demeanor, I feel like I would freak out every time.
It's a familiar feeling for people who are searching for starter homes. According to the National Association of Realtors, only 24% of buyers in 2024 were first-time buyers. That's the lowest share in more than 4 decades of reporting. At the same time, the median first-time buyer age went up to 38 years old from 35 in 2023. What happened to the starter home?
Starter homes nowadays in the Phoenix market are harder and harder to come by. When you look at the median sale price, we're somewhere around $450,000. Even with inventory going up, the number of homes that would be traditionally considered starter home are really low.
And that's shifting the perception of a starter home for a lot of would-be buyers.
They're looking at what would normally be the second or third home as their starter home because of price. Folks who used to enter the market and go, hey, we can buy a single property standalone home for $300,000, $350,000. Now they're looking at $450,000, $500,000, $550,000, $600,000.
And even with that price tag, there are still a lot of concessions.
$500,000, depending on the neighborhood. It's growing up in a home with my parents, it's like I can't afford what they had at the age that I am today. You're getting a lot less for more.
You don't see that much
The
space.
Hills wish list is modest.
A laundry room that's an actual room and not just a closet. You would think that'd be easier to find, but sometimes it's not.
That and a yard for this one. They know they'll find something, and it's fun to imagine what it'll actually feel like.
Breath of relief, I'd say.
Magical.
Yeah.
The realtor we spoke with suggests first-time buyers discuss what's important to them to determine how to make sacrifices during their house hunt.
What are your goals? What do you want out of this? And maybe you can't afford it, or you've been renting for the last 5 or 6 years, but by that time, maybe you're ready for a change. And maybe you get to a different part of town that also allows you a lot of the same, feel.
First-time buyers should also consider condos or townhomes, as the price tag is often lower and the maintenance is typically easier. There are programs across the country to help first-time buyers, including down payment assistance and low-interest loans. Just check with your state's Housing Finance Authority to see what resources it offers.
Up next, meet the nurse with no excuses in his medicine cabinet.
Everything is a challenge, but I live up to it.
How a life-altering car crash inspired him to work even harder toward his goal. Refusing to give up on his calling, a New Orleans nurse is making no excuses when it comes to helping heal others.
Reporter Maddie Kurth shows us how he's inspiring patients to overcome their greatest challenges.
And I get it done for my patients.
From an early age, Raymond Lewis knew he wanted to help others.
I think around elementary school, seeing my grandmother being a CNA, going in and out the hospitals, but I also was in and out the hospitals. I broke a lot of bones when I was a child.
The sights and sound of the hospital, once intimidating, began to feel familiar, even comforting.
I'm Ray. I'm gonna be your nurse. I'm just coming to check some vitals. No nursing called me, truly. That's how I feel.
And his dedication to that calling didn't go unnoticed.
When I think of Raymond, 3 of the things that come to mind are like strength, perseverance, and resilience, which really is the spirit of nursing.
When it came time to apply for nursing school, Lewis put his heart into Southern University.
I love him. I definitely love him.
Excelling in his coursework and building trust in his training.
Like a part of a family.
As he got closer to graduation, being anything other than a nurse never crossed his mind.
I didn't have a plan B.
Then, everything changed. He woke up in a hospital bed, heartbroken and confused.
Took my eyes off the world for a quick second.
But that's all it took. He says his car flipped 5 times. Doctors told Lewis the damage from his single vehicle accident was severe. They said he was paralyzed from the chest down.
I never, looked down on a moment of being paralyzed. I was positive when they came in and told me about the situation, the diagnosis. I just, it's the card I'm dealt, so I accepted it.
Lewis turned to rehab, giving it his all, even though his dream of becoming a nurse was suddenly out of reach.
Laying in that hospital bed, I had a lot of long nights of just thinking. Didn't know what my career path was going to lead to because I invested so much into the program, becoming a nurse.
Relearning the mundane, Lewis fought for every inch of independence. And through it all, his Southern University family promised there'd be a spot for him.
Okay, boy.
Whenever he was ready to come back.
Definitely brightened up my spirits while I was in there.
Slowly, he got stronger, made it outside, and learned to navigate life on wheels. And 6 months later, he was back.
Didn't want anybody to kind of use me as like a pity party.
Driven by determination, Lewis studied even harder, pushing further, knowing he had something to prove.
It's a challenge. Everything is a challenge, but I live up to it. Like I said, I don't make any excuses.
Lewis beat the odds. He crossed the stage and took his next leap of faith.
Were you nervous about getting a job?
Oh man, it was terrifying because the first thing I thought was that, nobody's gonna accept me, being in the wheelchair. I thought I probably was gonna have to change routes, try to do something behind the scenes.
But just like before, there was no plan B. Lewis interviewed with Ochsner Medical Center, and to his surprise, the hospital had big plans.
We immediately, it wasn't a can we do it, it was more of a how we're gonna do it.
Renata Scheck-Snyder, head of nursing, wanted Lewis on the floor, face-to-face, daily with patients.
It was scary because I'm like, man, I don't know if I'm going to be able to do that, being on the floor in a wheelchair.
And his patients feel that too.
You don't need anything else, you good? I'm good. All righty, well, call if you need me, okay? And there's been plenty of patients that tell me, man, I see you in this wheelchair, that makes me want to go harder and, do better for myself. I make it work, and they make it work for me as well. They see me in a wheelchair, they never turn me away.
He definitely has that it factor and really connects well with our patients, and they connect well with him.
The hospital says Lewis is the only nurse in a wheelchair in the entire state of Louisiana, a title he carries with pride.
I think he really embodies the spirit of nursing and is really a living example of that.
And each day, Raymond Lewis wheels himself to work with gratitude, purpose, and a smile.
Hey, how you doing? They could have turned me away and picked anybody else that's up and walking.
A testament to his strength and the life that can be rebuilt with a second chance.
They took a chance on me, and it's like, it's like a family. I love them.
Just weeks before earning his nursing degree, Lewis faced a devastating loss. His grandmother, who first inspired him, passed away, but he says her memory keeps him moving forward. What an impressive guy.
So inspiring. It's all about the power of the mind and what you're willing to accomplish in the hardest times.
And he was determined, and he's made it work, and he's inspiring, to so many people in the hospital when he's there working every day too.
I wish him the best career.
No doubt.
Well, that's it for us on Investigate TV Plus. I'm Tisha Powell.
And I'm Lee Zurich. Thanks for watching. On the next Investigate TV Plus, a warning from half a world away about the dangers of a highly contagious yet preventable infection.
It's broke me to a million pieces.
We examine the lessons learned about the deadly virus to understand why this happened and what the United States can learn from it.